Welcome to the M3 Medical Education Series. Today we are covering the Family Medicine Clerkship Survival Guide, everything you need to know before day one. This video is for educational purposes only and does not constitute medical advice. All patients should consult with their healthcare providers about any health concerns. Welcome to your Family Medicine Survival Guide, everything you need to know before day one. Family medicine is the broadest clerkship you will do in third year, and that is exactly what makes it both challenging and incredibly valuable. Whether you want to be a surgeon, a psychiatrist, or a family doc, this rotation teaches you the outpatient medicine that every physician needs. You will manage hypertension, diabetes, depression, low back pain, upper respiratory infections, and preventive care all in a single morning. Think of family medicine as the Swiss Army knife of clinical rotations. You see all ages, all organ systems, and all levels of acuity, from the healthy 18-year-old needing a sports physical to the 80-year-old with 6 chronic conditions. The shelf exam reflects this breadth, pulling questions from internal medicine, pediatrics, OB/GYN, psychiatry, and more. If you engage fully, this rotation will make you a better clinician no matter what field you choose. Many students are surprised to find this is one of their favorite rotations because of the variety, the lifestyle, and the genuine relationships you build with patients. Let us talk about what to do the week before you start. First, gear up. Your white coat pockets should have a pen light, stethoscope around your neck, a pocket reference card for screening guidelines, and your phone loaded with up-to-date Epicrates or MD Calc. Grab a copy of Case Files Family Medicine or the ambulatory chapter of Step Up to Medicine, whichever format suits your study style. Download the AAFP app and apply for free student membership immediately because their question bank is one of the highest yield shelf resources out there. Before day one, spend 2 to 3 hours reviewing USP, STEP, and B screening recommendations. Know when to screen for breast, cervical, colorectal, and lung cancer. Know lipid screening and diabetes screening guidelines. This is bread and butter family medicine content, and it will come up on rounds, in clinic, and on the shelf. Finally, skim common outpatient diagnoses, hypertension management, type 2 diabetes stepwise therapy, upper respiratory infections, and low back pain red flags. Walking in with even a basic framework will set you miles ahead. Day 1 logistics vary by site, but here is the general picture. Arrive 10 to 15 minutes early, dressed in business casual with a clean, pressed white coat. Most family medicine rotations are in outpatient clinics, so expect a roughly 9 to 5 schedule with occasional early starts for hospital rounding if your preceptor admits patients. Some sites include a continuity clinic day where you follow the same patient panel over time, which is a hallmark of family medicine training. Find the front desk staff and introduce yourself warmly, because they run the clinic and control patient flow. Ask where you can store your bag, where to find supplies, and where the restroom is. Then find your attending or preceptor and say something like, "Hi, I am your medical student this block. I am excited to be here, and I want to be as helpful as possible. What would you like me to see today, and how would you like me to present?" That last question is gold because every preceptor has different expectations, and asking early shows maturity and adaptability. Also ask about the electronic medical record system and whether they have templates for student notes. Understanding the team hierarchy on family medicine is simpler than most rotations, but still important. In a typical academic family medicine clinic, the attending physician is your primary evaluator and teacher. There may be a senior resident running their own patient panel, and in community settings, you might work one-on-one with a single physician. Advanced practice providers like nurse practitioners and physician assistants are often part of the team and can be great teachers. The nursing staff and medical assistants are essential allies. Learn their names early, offer to help with tasks like vitals or injections, and treat them with genuine respect. Unlike the hospital hierarchy with its layers of interns, seniors, fellows, and attendings, family medicine is typically a flatter team structure. This means you will get more direct attending time and more autonomy, but also more visibility. Everything you do, good or bad, is noticed. Here is what a typical day looks like. You arrive at 8 or 8:30, review the patient schedule, and pre-chart by reading through today's appointments. Identify why each patient is coming in, their active problem list, medications, and any outstanding health maintenance items. Morning clinic starts around 9 and runs until noon, with you seeing patients independently first, then presenting to your preceptor. You will likely see 3 to 5 patients in a morning session. Over lunch, you might have a noon conference, a case-based learning session, or protected study time. Afternoon clinic mirrors the morning from 1 to 4 or 5. After clinic, spend 30 to 60 minutes reviewing the day's cases using UpToDate or your review book, then shift to dedicated shelf study for 1 to 2 hours. The beauty of family medicine is the schedule predictability. Unlike surgery or OB/GYN, you will rarely be up past 6 p.m., giving you real time to study and take care of yourself. If you're finding this helpful, please subscribe, and hit the bell icon so you don't miss future videos. Now let us talk about pre-rounding and presentations. Pre-rounding on family medicine looks different from hospital-based rotations. Instead of checking overnight vitals and labs, you are reviewing the chart before each patient visit. Pull up the reason for visit. Scan the last 2 to 3 notes, check medication refills and labs since the last visit, and note any overdue preventive care items like mammograms, colonoscopies, or immunizations. When you present, use a concise SOAP format. Start with a brief one-liner. Mrs. Johnson is a 62-year-old woman with type 2 diabetes and hypertension presenting for a routine follow-up. Then cover subjective complaints, relevant review of systems, your focus physical exam findings, and finally your assessment and plan. Keep presentations to 3 to 4 minutes maximum. Your preceptor will appreciate brevity. The most impressive thing you can do is catch a gap in care, like saying, "I also noticed she is overdue for a colonoscopy and has not had a hemoglobin A1C in 8 months, so I would like to address those today." That kind of proactive thinking shows clinical maturity. Let us dive into the core medical knowledge you absolutely need for this rotation. Family medicine covers an enormous range, but there are key topics attendings will expect you to know cold. First, hypertension. Know the current guidelines. Stage 1 hypertension is 130 to 139 over 80 to 89. First-line agents are thiazide diuretics, AC inhibitors, ARBs, and calcium channel blockers. For patients with diabetes or chronic kidney disease, AC inhibitors or ARBs are preferred. Lifestyle modifications include the DASH diet, sodium restriction to less than 2,300 milligrams per day, exercise 150 minutes per week, weight loss, and alcohol moderation. Second, type 2 diabetes. Know the stepwise approach. Metformin remains first line along with lifestyle modifications. Second-line agents include GLP-1 receptor agonists and SGLT2 inhibitors, which have cardiovascular and renal benefits. Know your hemoglobin A1C targets, generally less than 7% for most adults. Third, depression and anxiety screening. The PHQ-9 and GAD-7 are your best friends. A PHQ-9 score of 10 or above suggests moderate depression warranting treatment. First-line pharmacotherapy is an SSRI. Fourth, upper respiratory infections. The vast majority are viral, and antibiotics are not indicated. Know the center criteria for strep pharyngitis and the guidelines for acute bacterial sinusitis, which requires symptoms for at least 10 days or a biphasic illness pattern. Fifth, preventive care. Mammography starting at age 40 to 50 depending on guidelines, cervical cancer screening with Pap smears starting at age 21, colorectal screening starting at age 45, lung cancer screening with low-dose CT for heavy smokers age 50 to 80, and lipid screening starting at age 20 for risk assessment. Beyond those 5 pillars, you should also know musculoskeletal complaints since they account for 15 to 25% of outpatient visits. Be comfortable with evaluating low back pain. Know the red flag symptoms like saddle anesthesia, progressive neurological deficits, unexplained weight loss, and history of cancer. Understand the approach to osteoarthritis versus inflammatory arthritis. Know basic dermatology, acne, eczema, psoriasis, and skin cancer screening. Understand well-child visits, growth curves, and the immunization schedule. And be ready for acute complaints like urinary tract infections, sexually transmitted infections, and acute musculoskeletal injuries. The breadth can feel overwhelming, but focus on the most common presentations, and you will be well prepared. Now let us talk about procedures and skills. Family medicine procedures vary by site, but common ones include joint injections, punch biopsies, shave biopsies, incision and drainage of abscesses, suturing lacerations, pap smears, and IUD insertions. You may also assist with circumcisions, vasectomies, endometrial biopsies, and colposcopies. The key is to volunteer enthusiastically for every procedure. Say, "I would love to observe and assist if that is okay." Most preceptors are thrilled when students show initiative. Practice your suturing technique before the rotation if possible, as laceration repairs are one of the most common procedures you will perform in family medicine. Also get comfortable with the musculoskeletal exam, particularly the shoulder, knee, and lumbar spine exams. These come up constantly in clinic. Other clinical skills to practice include proper blood pressure measurement technique, diabetic foot exams, and basic spirometry interpretation. If your site has a procedure room, make it a point to be in there whenever something is scheduled. Here is how to impress your team, and more importantly, how not to tank your evaluation. The number one behavior that earns great evaluations is being a self-starter. Do not wait to be told what to do. Pick up the next patient, go introduce yourself, take a history, do a focused exam, and come back with a differential and plan. Preceptors love students who demonstrate clinical reasoning, not just data gathering. Second, show genuine curiosity. Ask questions, read about your patient's conditions that evening, and follow up the next day with what you learned. Third, be reliable and consistent. Show up on time every single day, complete your notes promptly, and follow through on tasks. Fourth, treat every patient interaction as practice for your future career. Be kind, thorough, and empathetic. Now for the pitfalls. Do not be on your phone during clinic, ever. Do not show disinterest in common conditions just because they seem routine. Do not argue with your preceptor about management decisions. Do not disappear between patients. And do not skip out on documentation. Family medicine attendings particularly value professionalism and interpersonal skills because that is the foundation of longitudinal patient care. Let us tackle the shelf exam. The family medicine shelf is considered one of the harder shelf exams because of its sheer breadth, covering essentially all of medicine in an outpatient context. Your top resources should be the AFP question bank, which many students report as questions strikingly similar to the actual shelf. Combine this with OWorld, focusing on ambulatory medicine, internal medicine, pediatrics, and OBGYN questions. For a review book, Case Files Family Medicine is the most popular choice, or you can use the ambulatory chapter of Step Up to Medicine. Start studying from day one of the rotation, not the week before the exam. Aim for 30 to 40 OWorld or AFP questions per day, reviewing explanations thoroughly. Focus heavily on USMLE screening guidelines, as they are tested disproportionately on the family medicine shelf. Pay special attention to preventive care, chronic disease management, behavioral health, and age-appropriate health maintenance. The content has significant overlap with Step 2 CK, so every minute you invest here pays dividends later. A good study schedule is to do questions during lunch and after clinic, saving your review book for weekends. Try to finish at least one full pass through your question bank before exam week, then use the final days to review missed questions and weak areas. Let us bring it all together with a summary of the highest yield takeaways. Before the rotation, prepare your white coat supplies, download the AAFP app, review USMLE guidelines, and skim common outpatient diagnoses. Your daily workflow runs from 8:30 to 5, pre-charting before patients arrive, seeing 3 to 5 patients per half-day session, presenting in SOAP format, and catching gaps in preventive care. The top clinical topics to know cold are hypertension management, type 2 diabetes stepwise therapy, depression and anxiety screening with PHQ-9 and G87, URI management and antibiotic stewardship, and USMLE screening guidelines for cancer, lipids, and diabetes. Key procedures include suturing, biopsies, joint injections, pap smears, and incision and drainage. To earn a strong evaluation, be a self-starter, show curiosity, be reliable, and demonstrate clinical reasoning in every presentation. For the shelf exam, use the AAFP question bank plus OWorld, study from day one, and focus on preventive care and chronic disease management. Remember, family medicine rewards students who are adaptable, genuinely interested in the whole patient, and proactive about their own learning. Thanks for watching. Don't forget to like and subscribe for more medical education videos. References: Harrison's Principles of Internal Medicine, 22nd edition, Chapters 6, 37, 288, 382, 415 to 417, 463. USMLE Step A and B Screening Recommendations. American Academy of Family Physicians Clinical Guidelines. NBME Family Medicine Subject Examination Content Outline.